Association?
So in December of 2016, there was an article from Harvard researchers from JAMA, a research magazine, the Journal of the American Medical Association. And it researched the difference between outcomes of the patient between female providers, female physicians, and male physicians. The study was looking at hospitalized patients, and it was rather large. It was 1.5 million patients, and they looked at the difference in outcomes, mainly mortality, so death rate, and also readmission, so being discharged from the hospital and then coming back to the hospital. And those rates were clinically different, statistically different between female physicians and male physicians. And the results showed that the numbers were better for female physicians. It was big news because it really noted the value of the female physician in kind of generalized medical care, particularly hospital care in this study. But what it prompts us to look at is what are the differences in styles of what female physicians do and offer versus male physicians. And it's a sweeping statement to say that generally all female physicians are better than male physicians. That's not the point. The point is to really look at what the female physician is doing that maybe we can echo with and train our physicians kind of across the board. So the theory is that female physicians are more likely to adhere to clinical guidelines, kind of that standardized process. When you have a patient with pneumonia, you do X, Y, and Z. But it also kind of opens up a discussion of are female physicians more likely to provide patient-centered communication? Are they more likely to spend a little bit longer time talking with their patient? And are they kind of more reassuring and nurturing? And how does that translate to the patient response and ultimately outcome? So as a patient, how I would interpret the results of this study, assuming that you're not in the hospital, is that those values that we see with better outcomes can actually impact you as a patient in the clinic. So for a primary care doctor, you want to look for a patient-centered communication style, time spent with you, and that you're supported and listened to.